Hi everybody. Today we are here to answer the question, why failing to recognize aging parents' health problems can make life more difficult for adult children who are their caregivers. This can also be applied to spousal relationships or any caregiving relationship in your life. So, when aging parents or any person refuse to acknowledge their health problems or deal with them, the burden of care eventually falls on someone else, their children or other family members or paid caregivers. Because in all of our minds, regardless of the number on our driver's license or our birth date, we feel healthier. We feel like we're 10 years younger or 20 years younger, or maybe we still feel like we're 25 or 35. Especially if we're relatively healthy. So all of this denial or inattention to small things that we can change kind of comes to a crashing halt when a health emergency happens. When an elderly parent has a heart attack or a stroke, or they fall down and they break a hip. And so for the caregivers, for the family members, responding to these emergencies of other people is super stressful, especially if there haven't been any conversations about health or who is going to be the caregiver, or is there even money to pay for a caregiver. So how can we, as potential caregivers or adult children, recognize when the health of an aging parent is beginning to fail? In this video, I will offer specific information about 3 conditions common to the elderly: frailty, failure to thrive, and geriatric syndrome. Now, these come into play when an elderly parent either is healthy, has a few issues, or maybe they have a lot of health issues. These come into play across the aging spectrum. And what it can indicate is that their health is going to get worse and become more complicated, and your level of participation, however you are doing that, is going to grow and increase. So you can learn what to watch for and how to become more involved, when you should become more involved, so that you can prevent trips to the hospital emergency room or having to make decisions honestly in an emergency situation under pressure. If this is your first time here watching these videos, I'm Pamela D Wilson. I am a caregiving expert, advocate, and speaker with 25 years of professional experience. You can learn more about me. There's plenty of links below to my bio, my website, my online courses, my caregiver support group, all of that. Please also like this video, follow my channel, and comment, even if it's only to say thank you. Your participation helps other people find their way to my channel and to these videos. So the 3 terms we're going to talk about in this video: frailty, geriatric syndrome, and failure to thrive. These are terms that healthcare system, doctors, nurses use. You might hear somebody refer to them. So honestly, what do they mean, right? Well, frailty, anybody can be frail. I could be frail. It's defined as difficulty with walking, moving around, any type of balance, low muscle strength, memory loss, low physical endurance, you get tired easily, and low physical activity. So truly anybody of any age, depending on their health status, can be frail, but most likely frailty applies to older people, people over 65, 75, 85, 95. Frailty, though, more than the other 2 terms we're going to talk about, geriatric syndrome and failure to thrive, relates more to physical strength. So the way that you work with frailty is gaining physical strength, exercise, physical therapy exercises, things like that. So these things, if you notice them in your aging parents or in yourself, they're changeable. They can be improved. Look at a simple example. So let's say that it's the middle of the day and you're tired. And you're thinking, oh, I just want to go take a nap. But instead, you go out and you take a 1-mile walk. Your body wakes up. You don't feel sluggish or tired anymore. You have all this energy because You got blood flow, you got oxygen flowing throughout your body and your brain, and it's happy. But on the other hand, let's say that you're tired and instead you went to bed. Well, very low physical activity leads to being more tired and the inability to do the things you like to do. And it can eventually result in physical disability. Nobody wants that. How many of you have elderly parents who do nothing but sit all day in a chair? And they complain, I'm tired all the time. I don't feel good. Why do you think that is? It's because you don't do anything. You sit around all day. And many of us, let's be honest, many of us who work, we might sit around all day. We might be tired and sluggish and physically weak. The solution, the antidote, physical activity. So the number 2 thing to watch out for in aging parents is geriatric syndrome. And this is, there's no easy definition. Probably the easiest way to explain this is one condition that causes another condition that affects another condition that affects another condition. So it's like this combination of events. It's like this hurricane that builds, right? So it's category 1. Then it gets worse and it's category 2. Then it's category 3 and a 4 and a 5. Think of this as like the hurricane that is building unless somehow you can do something to stop it at stage 1, stage 2, or stage 3. So examples are an elderly person, let's say, who has memory loss or dementia, and they constantly have urinary tract infections that result in mental confusion and physical weakness. There are also older people who may have high blood pressure or heart conditions, and so any type of exertion makes them tired. Now, physical exertion can actually make them feel better, but they're thinking, well, if I get up and I do this, I'm tired, so I shouldn't do this. I should sit more. I should rest more. Well, then what happens is people think that they can do less, and then they end up being depressed and isolated because all they do is stay home and sit around. They don't go out and do things and be with people. So it's one thing leads to another. And then what happens is when you have all these health issues that keep happening one after the other, you may have to go to the hospital emergency room because you're worried about something happening. And then maybe you break a hip and then you have to go to a nursing home. And then you broke that hip, so you got to do, or you should do, physical activity and strengthening exercises to be able to walk like you did before you broke that hip, but a lot of people don't. I think the statistics are that 50% of people that have a hip fracture probably die within the first year. It might be 30%. But there is a percentage of people that just don't even make it through the first year. So combining health problems results in more physical disability and a need for more medical care. So if your parent has 1 or 2 or more conditions, that's a sign that their health probably is going to get worse unless, over here, some positive changes or some positive lifestyle factors are improved. So let's just look at combinations of things that happen. So you might have a parent who's incontinent. They have bladder control problems. And as a result, they have a urinary tract infection. And then they get skin infections or breakdowns because maybe they're not showering enough to stay clean. And then, very popular one, people who are incontinent, they have to go to the bathroom a lot. They reduce their fluid intake because drinking makes you go to the bathroom, right? And they don't want to have to continually get up and go to the bathroom. You know what that getting up and going to the bathroom is? It's actually physical activity. It's physical exercise. It's good for you. If you have to get up and go, you're not sitting in a chair all day. Drinking is important because it avoids dehydration. Being dehydrated can affect your kidneys and your liver and the ability of your kidneys to process any medications you take, to send toxins out of your body. It's this one thing starts the next, starts the next, starts the next. Difficulty sleeping, believe it or not, or feeling sleeping during the day is a geriatric syndrome. Where does it come from? You should know the answer. Low physical activity, weak muscles, poor nutrition, chronic diseases. This is not as someone would say, rocket science. When we think about health, we're smart people. We can start relating one thing to the next, to the next, to the next. If we think about it and if we seek education to say, well, why does this happen? It happens because of this. It happens because of A, B, and C. Weight loss is also very common in elderly parents. How do you think that happens? Your parents say they're not hungry. Why aren't they hungry? No exercise, no physical activity. They may eat like a bird. Or you may have parents who are overweight and they're eating a lot, but they don't have any activity. And what they're eating is not good for them. So they're actually malnutrition. They don't have enough protein in their body because they're eating things that have no nutritional value. Now, you'd never know that somebody who's older is malnutrition by looking at them. You don't know until you do blood tests or look into it a little further. Everybody needs protein to maintain muscle mass and physical strength. Elderly people who forget to eat or drink become dehydrated, become malnutritioned. They can experience mental confusion and delirium. They end up in the hospital. And being in the hospital is not good for any elderly person. That only results in more physical weakness because they're laying in a bed for 2 days or 3 days. And while they're there, they're losing muscle mass. They're becoming physically weaker. Going to the hospital, unless absolutely necessary, not good. And when you get out, you have a lot of work to do to get back to where you were. Same thing with a simple thing like brushing your teeth. If you have decayed cavities in your mouth or infection from your gums, all of that causes other things. It can cause heart conditions. It can cause pneumonia because you may breathe infectious diseases or infections from your mouth into your lungs, and then your lungs get infected, and then you have this pneumonia infection. There's just all kinds of things that relate to each other. And people with dementia can have a lot of other issues. They can have problems walking because of motor abilities and the ability to put one step in front of another, so they trip more. They can be more likely to break a bone. They can have issues with swallowing or choking. And again, that leads to pneumonia. So there are so many conditions or situations that result from a single diagnosis, especially when somebody is older. And so the best that we can do if we're trying to prevent our parents from getting worse is to be attentive to all of these little things and be as encouraging as possible. You know, for us that are younger, we know about all this. If we're taking care of somebody, we can avoid it. We have the foresight, we have the information, we have the ability to make a choice. The third condition is failure to thrive. So we talked about physical frailty that relates to just physical weakness, and then the geriatric syndrome, which is, you know, one thing causes the next and causes the next and causes the next. Failure to thrive is something that happens slowly over time with an older person or parent that we may not notice because the changes are so slow. They're so gradual. And it affects about, between statistics, 5 to 35% of people living out in the community. It affects more people who live in nursing homes because they have a little more of a constrained routine. So it's individual things, like maybe somebody has sinus problems and they get a cold all the time. And, it's just a nagging cold and it's not good. Or maybe somebody occasionally gets a urinary tract infection. Or a parent loses a little bit of weight, and because they wear baggy clothing, you can't tell. Maybe they've lost, 5% of their body weight. And you don't know until you help mom or dad into the shower and you're like, oh my gosh, you are skin and bones, right? So it's these little changes that we even could notice in ourselves. So let's say that we're pretty healthy, but, 5 years ago we used to run 10 miles and now we don't even run at all. That's a big change to our physical body. And what we may notice is that we're not in as great shape as we were before, but maybe it's not having a huge effect on our daily activities because we work all day and we sit all day. So if we're sitting all day, we're not noticing that we've become physically weak. That's like a huge, example of a huge change. But it's just those types of changes to notice in your aging parents. And so we don't think of, all this aging stuff as being bad or, waiting for the body to fall apart. We can kind of start noticing these things and try to find out the cause and how to be proactive so that they don't happen. So we all can be the person in our family who's going to be physically and mentally well when we're older if we learn about health and we're attentive to our health problems and we monitor things over time, because that's how things happen. It's just, they're so subtle. We don't even notice them, and then we got a problem. It's like maybe you're repairing your house. Maybe you noticed like that the drain was a little bit clogged and you just didn't do anything about it, didn't get the drain all right, and then now you got a big clog. Or, maybe your fence was starting to lean over a little bit and it wasn't that bad, so you didn't do anything, and then you have a big windstorm and the fence is down. It's these kind of things that happen in all areas of our life that we notice and we don't do anything about them until we have to. Well, with health, it's better to notice them and do something right away, because sometimes when we have to do something about it, it can be a little too late. And your elderly parents, you may say, hey, how are you? And they're fine. And you're thinking, oh, great, they're fine. You don't want to know. Well, your parents may not want to complain, or they may not want to be a burden, or they may not want you to know that they're having health issues. They would rather tell you that they're good than to tell you that they're bad, and then you start asking a lot of questions and you find out that, they're still smoking, or they're not exercising, or, the doctor told them to take those medications and they're not doing it. So when you ask your parents, they'll be like, oh, we're fine, everything's okay, we don't need any help. But you're thinking, I don't know, things don't seem right. I think you do. That's when you have to start saying, well, I'm noticing that this is different than it was before. Has something changed? You want to talk about these conversations and ask about these concerns in a very non-threatening way, because if you start pointing out problems, your parents may back off and then want to tell you less and less and less, and then you have a huge emergency that you are managing. For anybody who's older, not being proactive in seeking regular medical care, and even younger people, may lead to health problems that are pretty advanced. So regardless of what age you are, you should go get an annual checkup just to make sure everything's fine. If it's fine, great. If it's not, then you can do something about it. And for caregivers, this is so important, because the health and the well-being of family caregivers really, really suffers when you're taking care of older people. And you may not notice it right away. It may not show up until 5 years down the road. And 5 years down the road, you have 5 health conditions that you didn't have 5 years before. So it's this risk of being inattentive to all of these little things that can eventually snowball and become a huge, huge problem. So if your parents are in any stage of physical weakness or frailty, you know what to do, you know what to recommend to them. If they're experiencing geriatric syndrome because they have a lot of health conditions, it's being more attentive to medical care, making sure they understand how to change their health if they're willing to do that, take doctor's recommendations. Failure to thrive can be halted by noticing one thing and correcting it right away. But with all of this, it's important to seek out medical care and advice and follow it. And to ask your parents, what do you want for your health? How do you want to feel? How much do you want to participate? What do you want for your care? Because without having these conversations, it's very hard. And you as the caregiver may be saying, well, mom or dad, you have to do this. And then you're getting frustrated because mom or dad aren't doing any of this, and you feel like you're wasting your time, and you're frustrated and you feel like they're not participating. Well, they don't have to participate. Also, do your legal planning documents, medical power of attorney, financial power of attorney, living will and will, so that if something happens, you have all of this outlined. If you don't know about that, below this video, there is a link to my power of attorney course. It's free. It's in webinar format, just like this video. You can learn a lot about that legal process. Most of all, realize that you are the only one that can change your life. Your parents are the only ones that can change their life and their health. While you can make recommendations, you can't do it for them. And this is an area where so many caregivers become so frustrated. And I understand. You want the best for people. You hope for the best for people. But sometimes out there are just people who can't or don't want to help themselves or say, you know what, I've lived a good life. I don't want to go through all these treatments. If I die, I die. It's a hard place to be as a caregiver, but it is a place of reality, and having conversations with loved ones so that you understand why they participate or don't want to participate can be very helpful to preserve your health and your mental health. I'm Pamela D Wilson. I'm a caregiving expert, advocate, and speaker. Thanks for being here. Again, you can learn more about me with all the links below this video. Please like the video, follow the channel, comment, even if it's only to say thank you. Your participation helps other people find their way here. Have a fabulous day. I will see you all again soon in another video.